Marley Drug.
So today we're going to talk about commonly asked questions I get for a medication called Simvastatin, also known as Zocor. So what is Simvastatin and how does it work? Simvastatin is a prescription medication that belongs to a group of medications called statins. Statins help to reduce cholesterol, specifically bad cholesterol or LDL-C. If you're diagnosed with high cholesterol, your healthcare provider will typically recommend changes to diet and exercise first. If that doesn't work, then statins are your first line of defense. Simvastatin, like other statins, work to reduce cholesterol by lowering the amount of cholesterol your body makes by blocking an enzyme in your liver called HMG-CoA reductase. Simvastatin is considered a low to moderate intensity statin, depending on the dose you take. It's available in 5, 10, 20, 40, and 80 milligram tablets. However, the FDA has limited the use of 80 milligram dose of Simvastatin due to an increased risk of muscle damage. Although it's still readily available, only patients who have been taking Simvastatin 80 mg for the last 12 months without any problem should continue doing so. Simvastatin 80 mg shouldn't be initiated in patients on lower doses of the drug or who are new to statins. Instead, other statins should be taken into consideration. When is the best time to take Simvastatin? It's recommended that you take Simvastatin at bedtime or with an evening meal. This is because your body makes most of its cholesterol at night, so Simvastatin works better at lowering cholesterol at night than in the morning. That being said, as a general rule, it is recommended that you try to take the medication at the same time each day, as it's much easier to remember to take it that way. Keep in mind that there are other statins, such as Zypitamag, that can be taken at any time of the day because it has a longer half-life, which essentially means it lasts longer in your body. What if you miss a dose? If you do forget to take a dose, take it as soon as you remember, unless it's almost time for your next dose. In this case, skip the forgotten dose and take the next one at the usual time. Do not take 2 doses together to make up for a missed dose. So what are the side effects of Simvastatin? Like all medications, Simvastatin has a few side effects. Some common side effects include headache, cold-like symptoms, trouble sleeping or insomnia, nausea, heartburn, stomach pain, indigestion, constipation, and muscle pain, including joint pain. If you're experiencing any of these side effects, be sure to talk with your healthcare provider to determine whether a dose adjustment or switching to a different medication would be beneficial for you. Does Simvastatin interact with other medications? Yes, it can. Importantly, Simvastatin is processed by our body through an enzyme called CYP3A4. This enzyme is part of an enzyme family called cytochrome P450, and this family of enzymes is responsible for processing nearly 70 to 80% of all medications on the market. As a result, there are risks of taking Simvastatin with other medications. If you're taking multiple medications and are worried about potential drug interactions, there are other statin options that bypass this pathway, such as pravastatin, fluvastatin, and Zypitamag or pitavastatin. Some medications that Simvastatin can interact with include cyclosporin, gemfibrozil, amiodarone, fluconazole, fenofibrate, and medications used to treat HIV or AIDS, such as atazanavir. So what should I avoid while taking Simvastatin? Grapefruit and grapefruit juice should not be used with this medication since there may be an interaction that results in undesirable side effects. Avoid consuming food that's rich in cholesterol or fat. If you don't adhere to a diet that lowers cholesterol, Simvastatin won't be as successful in lowering your cholesterol. Avoid taking Simvastatin with alcohol. You may be at an increased risk of liver damage and your triglyceride levels may rise as a result. Like all medications, you should speak to your pharmacist or your healthcare provider about any questions you have. There's lots of information on high blood pressure, cholesterol, and other cardiovascular treatments on our website. Check out our blogs and the links below. Bye for now!